all going to experience to some extent, some more than others. Research has shown that there's a 3 to 8% decrease in muscle mass every decade after the age of 30, and it increases after the age of 60. So it's happening for us all. I mean, we're going to be that 3% or that 8%. But the way you can determine if you are experiencing this syndrome is, number one, you look in the mirror. You used to have those big guns, but the guns aren't as big anymore. You have less muscle mass. But also, when it becomes pathological, okay, is when you have loss in your strength. Maybe it's hard to open a jar or maybe carry your grocery bags. But also, as you lose that muscle mass, you can lose your strength in your legs, which can result in a loss in your balance, a loss in your bone mass as well, which could result in you having a fall and a fracture, which can be very dangerous, especially for our senior population.
Yeah, that's very important to know. Well, what's the cause of this condition?
Well, the condition occurs when you have a decrease in the size and the number of the muscle fibers, okay? And basically, the person becomes more thin. As I said before, the research has shown that there's a 3 to 8% decrease in the muscle size every decade as you get older, okay? And a lot of it has to do with aging. As we age, we have different signals within our body, and these include the hormones. And these signals let our muscles know to build muscle. And it also includes signals that say, let's break the muscle down. As we get older, unfortunately, we have more of those signals that say break the muscle down and less of those signals that say let's build the muscle up. And a lot of it has to do with those hormones, as I said. But another problem is some people get older, we have a diet that's very low in protein. And also we have inactivity. We don't move around as much, which is part of the cause as well. And also chronic medical conditions such as diabetes, heart disease, COPD, different forms of arthritis. All of these could be part of the contributing factors of someone having this condition.
So it sounds like you just mentioned how this problem can be treated. Is there anything else, Dr. Quinn, that you think would be helpful that I haven't asked you?
Most definitely. I mean, as far as the treatment, as we said, you want to protein as much as possible. Get exercise in. That's very, very helpful as well. Cardiovascular is good, walking, but also weight resistance exercise, building those muscles. If you can't lift weights in the gym, you could do the bands, you could do weights in your home where you're pushing up on the table, different things. We send patients to physical therapy to learn different exercises to build those muscles again. And also note if you have decrease in different hormones, which we check for, especially testosterone. For some men, we'll give them testosterone. And lastly, if you have chronic medical conditions, you want to get optimal treatment of those conditions such as diabetes, chronic heart disease, osteoarthritis, because treatment of these conditions can help reverse the process.
Are there any vitamins you recommend?
Basically, vitamins are very good, just a good multivitamin, but you want to focus on vitamin D. For as far as supplements, we really recommend the proteins. I actually do a protein shake twice a day to build those proteins up because I've hit the big 5-0 and I'll be 5'1" in about 2 weeks. So I don't want to lose my muscle mass, but that protein is really good, the creatine. But a good thing is to go visit your doctor every year to get panels done. So if you do have deficiencies in something, it can be identified and replaced.
Awesome stuff. Thank you so much, Dr. Quinn. We're running out of time, so stay with us. We'll be right back right after the short break.